Hi, Tyler Kirk. I wanted to speak with you today about a real hot topic. I've had a bunch of patients asking me about whether it's safe for their eyes for them to be on Ozempic or any of the semaglutides. And these are wonderful drugs for people with obesity or diabetes, and they've just been really life-changing for so many people. And of course, that's why they're so popular. But in the last few months, there have been some troubling reports about people having loss of vision while being on these medications. And this has created a lot of news. It's been all over the mainstream press. Just a quick Google search and you'll see all the big news sources talking about it. And this stems from two published research papers that were in the Journal of the American Medical Association Ophthalmology Journal, which looked at patients who were on the semaglutides and then looked to see are there optic neuropathy events that are occurring. Why did they study this? Because the neuro-ophthalmology clinics in some of the tertiary care facilities were seeing an uptick in adverse serious neuro-ophthalmic events, nonarteritic ischemic optic neuropathies, which is a painless loss of vision that's permanent, that were coming into their clinics among patients who are on these medications. Typically, it was people who had been on these medications for less than a year and had had rather abrupt changes in their hemoglobin A1C or in their weight levels. And so the dramatic changes in the body possibly could be contributing to why they had these optic neuropathy events. We're not really sure why. The honest answer is we don't have a causal relationship. We don't know why this is occurring. It does seem that there is potentially an increased incidence. There may be some selection bias for why it is that we're seeing this. The patients who are at risk for these optic neuropathy events are people who have pre-existing diabetes mellitus, obesity, increasing age, high blood pressure, cholesterol. All of those things, when they're out of control, you're at increased risk for a nonarteritic ischemic optic neuropathy, which can have serious adverse ocular consequences. But these are the people who are being treated with these medications. At this time, there's nothing inherently in the medication that we know of that's causing a problem. And when we look at the overall incidence among those people on the semaglutides in the published Harvard study in the JAMA Ophthalmology, it only shows an 8% incidence in that study population. And the general population of folks who were treated without the semaglutides had about a 1% incidence of that nonarteritic ischemic optic neuropathy. Now, there have been other studies, one published in the Journal of Ophthalmology, our best journal for ophthalmologists, that was out of Taiwan and looked at multinationally at people on semaglutides and Ozempic, and showed that there was no increased incidence of nonarteritic ischemic optic neuropathy. So the bottom line is we don't know enough yet. There haven't been enough studies. There haven't been enough high quality studies. The one that was done out of Harvard was just a retrospective cohort analysis, which in terms of the power of the evidence and the ability to link it to the drug is not very good. And so there may be something there. We need to know more. But the general recommendation, the American Academy of Ophthalmology and the Neuro-ophthalmic Society in the United States have put out statement pieces saying it is safe to continue to use your Ozempic or your semaglutide derivatives, and those medications can continue under the supervision of your physician. And if you have a serious decrease in vision, you should immediately seek medical attention for that. And at that time, it might be appropriate to discontinue. But there are serious benefits you're getting by being on those medications. And if your doctor thinks you're indicated for that, that you should probably continue to follow that. We'll continue to keep you updated if we know more. But at this time, that's what we know about these medications, and hope I am able to bring a little bit more clarity to what is a potentially alarming situation that people are hearing about.